I'm opposed to Obamacare expansion. I'm actually the only candidate running for governor this year in either party that is opposed to more Obamacare in Mississippi. I do not believe that putting 300,000 more Mississippians on government health care is a good solution. In fact, I think if you look at what's happened in Louisiana, they elected a Democrat governor in 2015. They soon expanded Obamacare in Louisiana. And there was a study that came out just recently that said in the state of Louisiana, somewhere between 3,000 and 5,000 Louisiana residents are being moved every single month. That's between 40,000 and 60,000 Louisiana residents are being moved from private insurance onto government health care. That's a bad solution for Mississippi. It was a bad solution for Louisiana, and quite frankly, it's a bad solution for lots of states around the country.
Mr. Waller, why is Medicaid expansion better for Mississippi? You have 90 seconds.
We have to do it. We have 31 hospitals in danger of closing. When the Obamacare was passed, they actually cut out a rural hospital subsidy under the assumption states would follow that. So I'm a conservative. I think everyone in the viewing area knows that Mike Pence is a conservative. In fact, Donald Trump hired his Medicaid director so that we can have conservative solutions. So Mississippi is neck deep in Medicaid. We have one of the largest participations in the country. To say that this is something new or novel is just disingenuous. We've adopted the CHIPS program. Several aspects of it we've already adopted. What I want to do is put conservative principles in there. We need to incentivize people to work, and that's what this does. The 300,000 people there, it's not Louisiana, this is Indiana and Arkansas. The Brookings Institute's already studied it. It's good for the citizens. It lowers the cost of health care. It would be $1 billion a year to our 115 hospitals, over 60,000 employees at no taxpayer expense. No taxpayer expense. The track record is there. The need is there. We cannot be closing hospitals.
Mr. Reese, over 300,000 Mississippians without the insurance. What do you do with those 300,000 that are uninsured? 30 seconds.
Adding 300,000 people to the rolls is the wrong solution. Judge Waller talked about the Indiana plan. The Indiana plan, just so everyone knows, was actually approved by the Obama administration. There was another state called the state of Utah who just in the last couple of weeks went to the Trump administration, and the Trump administration would not approve their waivers for a similar plan. And so I think it's bad public policy for the state of Mississippi.
Mr. Waller, so what do you think about that? Will it be bad public policy for the state of Mississippi? 30 seconds.
That's absolutely wrong. We're following the Arkansas plan. The metrics are there. The history is there. And what we have is these are people within 138% of the poverty line. These are people working every day. They can't afford insurance. There's no way in the world you can afford it. These are part-time people, no benefits. What we want to do is see primary care physicians. We want them to get in the workforce. Our workforce participation rate is 55%. It's the second worst in the nation. I want people to work, and this would incentivize that to do it.